Welcome to the Best Practices for Environmental Cleaning. This is Part C of Module 4 on General Cleaning. Part C of this module deals with other considerations around cleaning. My name is Jeffrey Holt, and I am an Environmental Services Leader, and I will be your presenter. Part C of this module addresses the last objective and looks at the other considerations in environmental management such as waste handling, sharp safety, and dealing with spills of blood or body fluids. Most waste generated in resident patient areas is not biomedical waste. Biomedical waste includes all of the categories identified. Cytoxic waste includes chemotherapy agents. Waste definitions will be dependent on the federal, provincial, and municipal regional legislation. Storage of waste is mandated within the legislation. Waste should be placed in an appropriate container at or near the point of origin. Store waste in a designated enclosed room which is accessible only to authorized staff. Biomedical waste should be stored in a locked area and refrigerated if stored longer than 4 days. There should be a plan also in place for dealing with excess waste, disruption of refrigerated area, disruption of waste removal services. Transportation of waste. All waste should be transported within the healthcare setting incorporating the following procedures. Clearly define transport routes. Minimize manual handling of waste. Avoid crossing through clean zones, public areas, or patient-resident care units. If dedicated elevators are not available, avoid transporting on the same elevator as patients, residents, or food-serving carts. Waste should not be transported at the same time as patient residents are transported. Transport waste in leak-proof carts, which are cleaned daily. When cleaning up blood or body fluid spills, assemble the materials required for dealing with the spill prior to putting on personal protective equipment. Inspect the area around the spill thoroughly for splatters or splashes. Restrict the activity around the spill until the area has been cleaned and disinfected and is completely dry. Put on gloves. If there is a possibility of splashing, wear a gown and facial protection, a mask, eye protection, or face shield. Confine and contain the spill. Wipe up any blood or body fluid spills immediately using either disposable towels or a product designed for this purpose. Dispose of materials by placing them into the regular waste container. If the materials are so wet that blood can be squeezed out of them, they must be disposed of into the biomedical waste container, such as a yellow bag. Disinfect the entire spill area with a hospital-grade disinfectant and allow it to stand for the amount of time recommended by the manufacturer. Wipe up the area again using disposable towels and discard into regular waste. Care must be taken to avoid splashing or generating aerosols during the cleanup. Remove gloves and perform hand hygiene. Sharps handling. Sharps are devices that are capable of causing a cut or puncture wound. All sharps must be handled with care to prevent injury. Prevention of sharps injuries may be achieved by using safety-engineered medical devices such as needleless devices, never recapping a used needle, never reaching into waste or sharps containers, providing rigid, puncture-resistant sharps containers at or near the point of use to permit safe one-handed disposal, replacing sharps containers when they are 3/4 full or the sharps have reached the fill line and securely closing the lid, handling laundry with care, and educating staff about the risks associated with sharps, including safe disposal of sharps in puncture-resistant containers if found in the environment. For example, sharps in laundry, in waste, at the bedside, or on floors. In order to safely dispose of a sharp, put on a pair of gloves. Ideally, take a sharps container to the needle and syringe. Never recap a needle and syringe even if a cap is available. Use tongs or forceps or similar implement to pick up the needle and syringe. If no implement is available, carefully pick up the needle and syringe with the needle furthest away from your fingers and body. Carefully place the needle and syringe into the sharps container. Report the incident to your supervisor or manager. Non-critical equipment. Like the client, patient, resident environment, Non-critical equipment may play a role in the transmission of organisms in a healthcare setting. Non-critical medical equipment within the client, patient, resident environment, and that is used between clients, patients, residents, requires cleaning and disinfection after each use. Policies and procedures should clearly define the frequency and level of cleaning required for each piece of equipment, plus assign responsibility for cleaning. Examples: person taking the equipment to use must clean prior to using, or person using the equipment cleans after use. When purchasing new equipment, the ability to effectively clean and disinfect the item must be taken into consideration prior to purchase. Low-level disinfection should be used for all non-critical equipment. Examples of non-critical equipment include bath seat and raised toilet seat, resuscitation cart, blood pressure cuff, commode chairs, IV pumps, ECG machine and cables, transfer boards, stethoscope. Learning checkpoint. True or false? Waste may be transported on an elevator at the same time as patients, residents. To neutralize a blood spill, apply the disinfectant before wiping up. Laundry should be handled with care to avoid a sharps injury due to sharps being left in the laundry. Commodes within the patient-resident environment and that are used between patients and residents require cleaning and disinfection after each use. Learning checkpoint answers. False. Waste should not be transported on an elevator at the same time as patients, residents, to minimize the risk of contamination. False. Blood spills should be contained and material wiped up before applying the disinfectant. Disinfectants will be ineffective if applied before cleaning the spill. True. Sharps accidentally left in bedding may pose a risk to healthcare workers. Care should be taken when handling all linen. True. All non-medical equipment that is shared between patients, residents should be cleaned and disinfected before being used with another patient, resident. When you return to your job, what will you do differently as a result of this session? Make a list of 3 things you will do differently as a result of this session. This concludes Module 4 on general cleaning. Thank you.